Hi there, welcome to your Bone and Joint channel. This is Dr. Shayesteh, your orthopedic surgeon. Today we are discussing shoulder pain. I'm going to show you a picture that's the anatomy of a shoulder. Shoulder is made up of several layers. As you can see in this picture, it shows clearly the anatomy of the shoulder. That's a clavicular bone, and then we have humerus bone, and then that's scapular bone, and there is muscles, ligaments, and bursas around the joint. So as you can see, this is a very beautiful picture. You can see that's a clavicular bone. Then we have acromion, humerus bone, and then scapula. These are the ligaments, coracoclavicular ligaments. And then we have acromioclavicular ligament, coracohumeral ligament, and then glenohumeral ligament. There are some other elements, bursas, which they help for the smooth movement of the shoulder joint. Later we will discuss some of these elements. This is the anatomy of the shoulder. You can see it's a combination of three different bones: clavicle or collarbone, scapular bone, which it has coracoid process and acromion process, or shoulder blade, and humerus bone. And this is the glenoid cavity. That's a part of a scapular bone, which that's a part of a shoulder joint, which is a part of a shoulder joint. As you can see, that's the ball and socket joint, but the head of a humerus is much bigger than the glenoid. That makes the shoulder joint in its own nature a very unstable joint and prone to dislocation. This is another beautiful picture of a shoulder, acromioclavicular joint, glenohumeral joint, and then sternoclavicular joint, which connects the clavicle to the sternum in mid-chest. And then we have this rotator cuff. That's a very important part of the shoulder joint. There are four muscles. They come together and make a rotator cuff muscles. There is a supraspinatus muscle, infraspinatus muscle, teres minor, and then we have subscapularis muscle. All three of the supraspinatus, infraspinatus, and teres minor, they come together, and the ligamentous parts come together and give support from the posterior part of the shoulder joint. And then we have subscapularis muscle, which its tendon part comes to the front of the shoulder joint and helps the shoulder joint in anterior side for the stability, for its stability. What causes shoulder problems? We should keep in our mind, shoulder joint is the most movable joint in the body. It makes it unstable because of the range of motion. It's almost 360-degree range of motion. And then the nature of the joint, as I explained in the previous picture, because the head of the humerus is much bigger than the glenoid space, so it makes it, it's in nature, it's very unstable joint, and definitely shoulder joints needs to have some support from the muscles, ligaments, and the tendons around the joint to make it more stable. That's why it's very susceptible to any different kind of injury on the joint. What are the shoulder pains usually we experience? Mostly the shoulder pain, sometimes patient feels pain while sleeping, or sometimes just a pain while exercising, or even any overhead movement can be painful. Sometimes patient experience sharp pain while overhead movement, and or might feel instability in the joint. Any of these complaints and symptoms can be just a minor concern or indicator of a serious issue. Let's see what are the reason for the shoulder pain. Shoulder pain is usually caused by traumatic injuries, repetitive motion injuries, or long-term wear and tear in the joint or tissue disorders. What are some of the different type of shoulder problems? Let's see what are the type of the shoulder problems. First of all, we are going to talk about a shoulder dislocation. Shoulder dislocation occurs when humerus bone separates from the shoulder blade at the main shoulder joint. As we said earlier, shoulder joint is a very susceptible joint to the injuries and dislocation because it's very unstable joint, and it's because of the big range of motion which shoulder joint has, it makes it susceptible for injuries. So shoulder joint is most often dislocated in the body. That's one of the common joint that gets dislocated in the body. So it happens usually by a strong force or extreme rotation of the shoulder, such as a hard hit during contact sports or motor vehicle accident or even a fall. When the injury happens, patient or you may feel some sort of inability to move your shoulder. Intense pain. Sometimes patient can experience numbness, even weakness, and a visible deformity or out of place shoulder, with or without swelling. Then we have other problems in the shoulder as a reason for the pain. One of the problems is frozen shoulder. Frozen shoulder or adhesive capsulitis is a general term which we use for all the causes of motion loss in the shoulder. The symptoms are the symptoms that patient might come to us are trouble lifting your arm above your head, reaching across your body, or reaching behind your back. It can be associated with some inflammatory arthritis, and some other disorders like thyroid disease or diabetes. Then we have rotator cuff tear. That's another reason for the shoulder pain. A partial or complete tear of rotator cuff, a system of 4 separate muscles that move and stabilize the humerus in the shoulder joint. The rotator cuff muscles and tendons may be injured by trauma such as falling, when skiing or biking, or from arthritic spurs that form within the shoulder and erode the cuff tissue over the time. As you can see in this picture, this is the rotator cuff tear. In this picture, we are seeing all the rotator cuff muscles, trezor minor, infraspinatus, and supraspinatus. That is their attachment point in the posterior part of the shoulder. And we have partial tear here, just a supraspinatus tear. It's very common actually, just have only partial tear in the rotator cuff tear. Then there are some other reasons for the shoulder pain. One of the common one again is clavicle fracture or broken collarbone, which most often happens from falling or landing directly onto your shoulder, such as while bicycling, skiing, or snowboarding. The collarbone or clavicle is directly under the skin with very little overlying tissues, which makes fractures visible to the naked eye or even protruded to the skin. You could see in this picture, that is it, the position of the fractured part of the clavicular bone, which is protrude out of the skin. It's very easy to see the fracture with your naked eye. And then we have another fracture. This is again the X-ray of the same fracture. You could see that one. Then one of the other reasons for the shoulder pain is arthritis. Basically, arthritis means wear and tear of a shoulder cartilage until bare bone is exposed. The shoulder joint can sometimes become narrowed and arthritic, and spurs can form on the undersurface. Then we have shoulder separation or an acromioclavicular joint separation occurs when the joint of the clavicle and the scapula are disrupted. This is often the result of a direct trauma to the shoulder. AC joint or acromioclavicular joint separation symptoms usually includes some sort of instability, pain, especially when making overhead movement or cross-body movement or during sleep. That's why some of the patients experience the pain while sleeping. There may also be a produce bump or bulge at the joint line on the top of the shoulder. It has again a visible deformity above the shoulder. As you can see here, this is a separation of a shoulder joint, acromioclavicular joint, and you can see clavicle is visibly above the shoulder. It moves upward. The reason for the frozen shoulder has been. How are shoulder problems diagnosed? How we can diagnose them? Your doctor first need to take a medical history, complete medical history and physical examination to determine range of motion, location of the pain, point tenderness, level of the joint instability or stability, and any history of fall, sport injuries, anything that might help for the diagnosis. Usually when the doctors, you visit your doctor, after the history and full examination, your doctor needs to send you for some diagnostic measurements that you have to do, and the doctor needs to find out what is the main reason for the pain. So the first step is the X-ray, which usually gives a clear picture of the bone and sometimes some of the soft tissue as well, if there is any swelling or any other things. But usually it's good to see if there is any bone or joint fracture or dislocation. And then the second step, if still there is something that your doctor needs to go for more investigation, if the X-ray is not enough to find out what is the main reason for the pain, your doctor needs to send you for MRI, magnetic resonance imaging test, which it gives the clear indication of any injuries in the soft tissue, in the joint itself, any cartilage injuries, anything which around the joint can give a clear picture of the diagnosis. And then CT scan as well, computerized tomography scan, which can help the doctor to see different elements of the around the joint, especially the bone, again fracture, any injuries in the cartilage, and we can have 3D image of the joint as well. Treatment of the shoulder problems. Your age, overall health, and medical history can help the treatment or extent of the condition in the shoulder. Your tolerance for specific medications, procedures, or therapy can vary, and your expectation from the treatment as well. And sometimes even your opinion and preference. Your doctor might offer some sort of treatment, and you might not really agree with that one. So any of these things, even your personal decisions, also can affect your treatment. Treatment may include activity modification. Sometimes you need to change your sport activity which you are doing, at least for sometimes. Then you need to have rest, definitely, especially in the beginning. In the first step of the treatment, you need to have some rest. Avoid any extra exercise or extra activity or whatever. You have to stop your joint from the movement for some times. It depends what sort of problem is there. It can vary from weeks to months. Physical therapy, then medications and surgery. That's all for now for today. In the future video, I'm going to explain more of the complaints and the different kind of treatment that we have for the shoulder. Thank you for joining to your Bone and Joint channel. Please do so again, and we are happy you are here, and I am happy you are here, and I hope these videos can help you to understand more of orthopedic problems. Thank you very much.